Good afternoon, everyone. I'm Beth Stewart, and on behalf of the Texas Oral Health Coalition, welcome you all to today's webinar entitled The Healthy Smiles Project, Increasing HPV Vaccination Through Interprofessional Partnerships with Dental Hygienists. Today's presentation focuses on the role dental hygienists may have in improving HPV vaccine uptake for their local communities. Dr. Griner will share information about the Healthy Smiles Project and discuss ways to advocate for the HPV vaccine and how dental hygienists can increase HPV vaccine implementation into the dental setting through community-based immunization events. Dental providers may earn 1 hour of continuing dental education credit for submitting the completed online evaluation. If you should have any questions regarding the evaluation process or need assistance, please don't hesitate to contact us at info@texsoc.org. Our presenter today is Dr. Stacey Griner, who is an assistant professor in the School of Public Health at the University of North Texas Health Science Center in Fort Worth, Texas. Dr. Griner received her PhD in 2019 from the Public Health College of Public Health, University of South Florida, and her master's in public health from the University of Florida in 2014. Prior to entering academia, Dr. Griner practiced clinical dental hygiene for more than a decade. Her research focuses on translating evidence-based guidelines and policies into clinical care. Dr. Griner has substantial research experience in oral health and sexually transmitted infections, writing in 62 peer-reviewed publications, including substantial contributions to a number of extramural grants from MD Anderson Cancer Center and Health Resources and Services Administration. It is with great pleasure that I introduce you to Dr. Stacey Griner. And Dr. Griner, the floor is yours.
Thank you so much, Beth. That was a great introduction. I appreciate it. Okay, that's looking good to me. So it's great to be here. I'm so happy to be talking about this project. It's one of my favorite pieces of work that I've been involved with. So I'm also looking forward to hearing if you have any thoughts. So feel free to let me know as this project progresses. So I first want to say that this initiative, the entire project I'm talking about today, is supported by the University of Texas MD Anderson Cancer Center. They've been an incredible partner and super supportive of this work, which is a unique perspective. Their focus is on increasing vaccine rates. So I'm happy that they're invested in this topic, and it's been a great experience working with them. Just want to give you a little bit of background about me. I graduated with my associate's degree in 2009. I can't believe it's been that long. And then I got a bachelor's degree in dental hygiene education because I thought I was going to go into education and teach in a dental hygiene program. Then I found out a little bit more about public health, went into a public health program, and then a PhD in public health. So now I focus on research and have done a lot of work in oral health. So it's been a really unique intersection of public health and oral health. I also want to give a shout out to the other members of the team, Dr. Nolan Klein, Dr. Malini Neelamigam, Dr. Erica Thompson, and our incredible project coordinator, Ali Ferris. Without them, I don't think we would be as successful with this project as we have been. The learning objectives that I've identified for today, there are 3 of them. The first one is to identify the role that dental hygienists may have in improving HPV vaccine uptake. The second is to describe the current rates of HPV vaccination in Texas. And also I'll provide some context about North Texas specifically. And then I'll summarize the process of implementing immunization events into community-based oral health settings. So this presentation focuses on the role that oral health providers, which includes dental hygienists, but also dentists, dental assistants, front office staff, may have as alternative providers of HPV vaccine recommendations. So I'll be talking a lot today about what dental hygienists' role or ability looks like in reducing missed HPV vaccine opportunities. And I'll talk a little bit about our work in Texas. So the big thing that I'm discussing today is an ongoing project, and that project has two goals. The first one is to educate dental hygienists about being advocates for the HPV vaccine, and the second is to increase HPV vaccine implementation into the dental setting through these community-based immunization events. So how did we get to this point? Why are we even talking about this topic? HPV-related oropharyngeal cancer has surpassed cervical cancer as the most prevalent HPV-related cancer. Um, Certain strains of HPV cause about 70% of oropharyngeal cancers in the US, and these rates are continuing to increase. And so, in response to this, in 2020, actually, the 9-valent vaccine, HPV vaccine Gardasil, was approved by the US FDA for the prevention of oropharyngeal cancers and other head and neck cancers that are caused by these certain types of HPV. So that was a big step, saying that the vaccine was indicated for the prevention of these cancers. And so, in response to this, and even prior to the vaccine becoming recommended, the American Dental Association has always urged dentists to promote HPV vaccination as a form of cancer prevention and to educate themselves and their patients about the relationship between HPV and oropharyngeal cancer. Also, there are recommendations from the American Academy of Pediatric Dentistry. They recommend that oral health providers educate patients, parents, and guardians on the relationship between HPV and oropharyngeal cancer, and counsel patients, parents, and guardians regarding HPV vaccination in accordance with the CDC recommendations. So, recommending following the guidelines that are released by the CDC. This is a lot of information. How I've distilled this down in this work is that recommending that providers educate, recommend, and refer their patients for the HPV vaccine. This is kind of just a snapshot of how I see this working in my mind, my mental pathway on how this works. And so, knowing that dental providers may have a role in discussing the association between HPV and HPV-related disease, there's a probability that they can increase HPV-related vaccine rates and ultimately lower the rates of these cancers. Dental providers are in a unique role. They may have access to parents and children who might have the greatest need for this vaccine. So we continue to explore provider recommendations and their roles in these topics. I first want to set the stage with some previous work that we've done with oral health providers to talk about how we kind of got to this point in working on this project. So a few years ago, we did quite a few focus groups with dentists and dental hygienists, and also did some interviews with opinion leaders in the field. So these are policymakers, leadership in dental organizations, or other people who might be making guidelines or providing recommendations for the dental field as a whole. So as you can see, I'll report on these results at each level. I'll just talk about them very briefly to give you the context. But overall, the findings were that providers, dental providers specifically, identified and described their role in HPV cancer prevention and vaccine education. And they viewed HPV-related primary prevention through education, but also secondary prevention through oral cancer screenings as within their scope of practice. Dental hygienists specifically viewed HPV-related cancer prevention as within their scope of work and called themselves prevention specialists. So I'll start with the macro level. Participants from each stakeholder group, so dentists, dental hygienists, and opinion leaders, describe the influence that their professional organizations have on their practice behaviors. One of the focus groups of dental hygienists specifically mentioned the ADA, but along with them, the American Dental Hygiene Association, as sources of information that help them normalize discussing sensitive topics with their patients. Dental hygienists asserted their role in health prevention. They referred to themselves as prevention specialists, as I said before, and also emphasized that seeing patients is an opportunity to engage in preventive health conversations. But for dentists, there was more variation in their perceived roles. Some thought that the prevention of HPV was within their scope of practice, while others noted that it might be a better fit for dental hygienists because they have a unique role and expertise in education. One thing that both provider groups talked about was how dental policies vary by state, including the types of continuing education required and dental hygienists' ability to practice in different settings with or without dental supervision. They also talked about specific dental care services that can be offered in other settings, like pediatrician's office, and what they could talk about with minors and other liability rules. There are also some limitations around who can provide vaccination. COVID has changed that, so there are over 20 states that now allow COVID vaccines by dentists, but there are very limited states who allow dentists to vaccinate for HPV. Another unique finding from this was that participants discussed the lack of interprofessional relationships between medical and dental, also between public health as well. They saw this as an impediment to integrating HPV vaccines into dental care. Dental hygienists also reported an overall lack of respect from other healthcare professionals and talked about the need to strengthen interprofessional relationships and collaborations. Some of the solution focus components that were mentioned in the focus groups were improving perceptions of the profession of dentistry as a whole and the need for dental hygienists to be recognized as experts in oral health care. Dentists noticed that their interprofessional relationships were generally limited to those with other dental specialties, such as oral surgeons or periodontists, and they suggested that these relationships should extend to other healthcare providers and establish relationships with physicians who can impact HPV vaccine uptake. So now we'll talk a little bit about the meso level. This one is much shorter. Participants discussed the influence that their interpersonal practice environment, such as roles or communication patterns among the dental team, might have on HPV prevention discussions. So dental hygienists felt they could discuss HPV vaccination with patients, but they were concerned about the amount of time it might take. Most dentists felt that hygienists should discuss HPV vaccine with patients because they have more access to the patient and spend more time with the patient, but also because they focus on educational aspects of oral health. One common barrier that came up is that most dental providers were concerned about the lack of privacy in dental offices. Many dental offices have open operatories, so that restricts the privacy that people have when they're having conversations about HPV. Another unique thing that came up is that most dental hygienists mentioned fee-for-service models or power hygiene models. They said that they feel limited in their ability to build rapport or educate patients. They also discussed the pressure to use technology or other oral cancer screening tools with patients because of the fees and revenues that were associated. This kind of all fell under the fact that some dentists and some practices were perceived as having a more business model orientation and may be more concerned about offending patients and losing them to other practices than public health dentists might be. So this came up a lot. There were also concerns about speaking with specific populations about this, so talking to pediatric patients about the HPV vaccine. And they also talked about the need for group practices to be consistent. So all practices within the dental office to be consistent. So this was really unique. I think the most common barrier that came out of this was the time limitations, but also the physical component of lacking privacy. And then finally, on the micro level, dental providers felt uncomfortable talking about HPV vaccine compared to talking about other oral health topics. And they said that some of their discomfort might stem from HPV primarily being viewed by people as a sexually transmitted infection. Dental providers reported that they were sort of knowledgeable about HPV vaccine. They're somewhat knowledgeable, but they felt that they lacked the skills to have these types of conversations with patients. But dental hygienists overall were more receptive to educating patients about HPV prevention, since patient education and counseling often fall within their scope of work. Younger patients, both older and younger patients, so the two extremes, dentists and dental hygienists reported they might have some discomfort in talking about the HPV vaccine with them, and they reported they may be concerned about the patient or parents' reactions. But one of the main solution points that was mentioned there is building a rapport with patients prior to talking about the HPV vaccine with them, and assessing the patient's attitude to determine if the patient was interested in receiving this type of information. And one of the biggest findings that came out of this is that patients usually lack knowledge about HPV and HPV prevention and why it might be relevant for dentists and dental hygienists to be discussing this. So a few providers reported that they had some experiences with patients talking to them about HPV, but overall, most said that their patients aren't even sure that they're being screened for oral cancer. So talking about oral cancer screening with patients when it's occurring is one of the things that providers recommended there. So that kind of sets the stage for where we are and what we've done in previous work. But because we're focusing specifically on Texas, it's a really unique vaccine context here. So I want to go over some of the HPV vaccine rates in Texas and even give you some more specific rates in North Texas, which is where this project was. So we can just understand kind of the situation in which we're being immersed. So in Texas, HPV vaccine uptake is generally low, with less than half of the 13 to 17-year-olds being up to date on the HPV vaccine. This was as of 2021. The national average is about 62%, so we're about 10% behind there. Texas is a 48th state in HPV series completion, so HPV vaccine is a multiple dose vaccine at the current time. We are 48th in completing the series, and we're also 44th in initiation. We have about 70% of our kiddos who are age eligible for the vaccine, even starting the HPV vaccine series. Nationally, it's about 77%. Also, things have changed with COVID. Vaccines and vaccine hesitancy has really come to the forefront. So I think we're going to be addressing that through, we're looking at that as a potential impact that it might have on HPV vaccines as well. And there are a lot of rural areas in Texas which often have even lower rates of HPV vaccine uptake, and these rates continue to widen. So like I said, I'm in North Texas. I'm in Fort Worth, but we were focusing on Denton County for this project. Two of the most populated cities in North Texas are Dallas and Fort Worth, and they reported about half of their adolescents were up to date on the HPV vaccine, and those are both rates are lower than the state average. And I'm talking specifically about Denton. These rates may be even lower because Denton is growing very quickly. There's a large population of uninsured children, but we have limited information about their vaccine rates. Denton is also growing fast, and it's the 9th most populated county in Texas, so it is emerging as one of the bigger cities that we have here. So parts of Denton County still remain rural. So we have these extreme differences in rural counties, but also these highly populated cities, both of which can impact HPV vaccine uptake. So in addition to being located in Texas, which already has vaccine disparities, there's a high rate of uninsured children and rural pockets in the county. We selected partnering with organizations in Denton County to develop these HPV vaccine interventions. So we also have some data from oral health providers. We don't have anything specific from Denton County, but there was a survey of dental providers conducted in 2020 among dentists and dental hygienists in Dallas County. This was in partnership with the Texas HPV Coalition. And I will say that most of the participants who completed the survey were dentists. So the findings this was specific about HPV knowledge. Almost 65% of dental providers felt that they didn't have adequate knowledge about the HPV vaccine, and 37% of dental providers didn't know where to refer their patients to get the vaccine, even if they recommended it. And so focusing on increasing oral health providers' communication and advocacy skills in recommending and referring their patients for the vaccine can reduce these vaccine-related health disparities, particularly when we're going into a space like Denton County, where things are already complex. And this is especially important to consider because parents say that they would feel comfortable with dental hygienists recommending information or providing information and recommending the HPV vaccines in the dental setting. So this is an area we're exploring further because patients are receptive to it as well. So this project focused on coupling HPV vaccine access with community-based oral health services. And our goal was to reduce barriers to both, so community-based oral health services, but also vaccine access, and focus on creating a pro-vaccine environment. And that's where we got to the Healthy Smiles initiative in partnership with MD Anderson. So the University of North Texas MD Anderson Cancer Center is a comprehensive cancer center designated by the National Cancer Institute, and its service population is the state of Texas as a whole. So MD Anderson has an HPV vaccine initiative group. They have a commitment to prevention as part of their core mission, and they've identified opportunities in Texas to move vaccine uptake forward. To do this, they assembled a transdisciplinary team and worked together to develop an institutional framework that focused specifically on adolescent HPV vaccines, and the goal was to reduce HPV vaccine cancer burden. So the framework was developed and activated through a four-phase approach with aligned with the National Cancer Institute community outreach and engagement component. And MD Anderson worked to identify collaborators through data-driven outreach. And they also constructed a portfolio of collaborative multi-sector initiatives. So creating this implementation community, they ultimately ended up with 78 institutions represented and collaborations across those institutions. But also there are now implementing 12 projects like this one that use the same shared measurement in 18 different counties in Texas. 3 of those projects focus on oral health providers. We're one of them. There's another one that focuses on incorporating HPV vaccines into a dental clinic. So they're actually being there, being able to provide the vaccine on site. And then there is one occurring at a federally qualified health center. So they're looking at changing the system in the qualified health center to provide vaccines. The ultimate goal that MD Anderson has through this specific project is to invest in evidence-based strategies to increase HPV vaccine and to solve challenges that are preventing implementation of the recommended strategies, but also to encourage replication of the projects that are successful from this initiative. So we've been working with MD Anderson since about April 2022 on developing this implementation project. And we ended up with 3 goals for this project. The first one is to promote vaccine advocacy among oral health providers. So that includes making them advocates not only for the vaccine, but advocating for themselves in their practice as vaccine advocates. Implementing immunization events in the community to improve access and vaccine rates, and strengthening the relationships and partnerships between community organizations so that the project can continue on, the project and the events can continue on and be sustainable. So in this implementation project, we propose using some strategies and activities that I'll talk about in a little bit in Denton County, and all of these strategies align with the strategic framework that was identified by MD Anderson in the past slide. So earlier I gave an overview that said I was going to talk about oral health providers and their role in HPV vaccine recommendations, but specifically I'm going to talk about dental hygienists. So our project here is broken into 2 parts. The project seeks to promote health equity by partnering with community organizations and clinics to provide care to underserved communities. That's the HPV immunization piece. And we focused in Denton County, specifically in areas that might lack access to the vaccine. We also focused on dental hygiene specific vaccine advocacy trainings and implemented these community-based immunizations events into practice. So I'll talk first about the HPV advocacy training, and then I'll talk a little bit more about the events. We've done 3 of them, so I think we have a good sense of where we're headed in the future. So the advocacy training, developed this. We partnered with Jane Cotter. She is a dental hygienist at the Caruth School of Dental Hygiene at Texas A&M. She has a clinical practice background, but also she's been working in dental oncology and HPV-related cancer prevention for a while. And she has a previously developed continuing education course for dental hygienists about this topic. It focused on adjusting attitudes and confidence about this vaccine education. So to work with her, she worked on modifying the existing continuing education course that she had to include these advocacy components. So how do you advocate as a dental hygienist? How do you advocate for yourself and your role in your practice? And what if the dentist that you partner with doesn't want you to discuss HPV vaccine? But also, how do you advocate for this with your patients? Specifically, if you think back to all the guidelines that came from the American Dental Association and the American Academy of Pediatric Dentistry, we include specifics focusing on educating, recommending, and referring for the vaccine. The advocacy training also included skills on how to make a strong recommendation, including announcement language, bundling the vaccine with other adolescent vaccines and recommending it in that way, focusing on vaccinating young adolescents and promoting vaccination of boys and girls equally. So our primary partner throughout this project has been Texas Women's University, their dental hygiene clinic. They've been an incredible partner, and I have been thrilled to work with them. They have a great dental hygiene program. So that was where we did our first advocacy training. For all of these that you'll see here on the screen, all of these continuing education courses that we gave and provided the advocacy training, we did a pre-test, a post-test, and then either a 1-month or a 3-month post-test. Our measures focused on confidence, knowledge, and experiences when people have referred their patients for the HPV vaccine. So we partnered with the dental hygiene students through Texas Women's University. We also were able to work with some practicing dental hygienists in North Texas through partnering with the Greater Fort Worth Dental Hygiene Association, and also a lot of different providers from the Texas Oral Health Coalition. A unique place where we conducted this advocacy training was at a meeting of the dental hygiene educators of Texas. So a lot of the people who were in attendance were either instructors or program directors of dental hygiene programs in Texas. So that was really unique. One of the ways we've made this sustainable is that we've partnered with Texas Oral Health Coalition, and the training is available as a self-instructed course at any time. So we have preliminary data right now. We're still in the data analysis portion of the project, and we're continuing to collect some more follow-up data. So overall, we're estimating we've reached about 325 practicing dental hygienists, 110 dental hygiene students, 30 dental hygiene educators and program directors of dental hygiene programs, and 4 dentists. So some of the results that we've seen specific to knowledge is increases in knowledge about HPV cancers overall. So identifying that HPV has a role in oral cancers, but also identifying the types of cancer generally that are associated with HPV. For self-efficacy, after the training, 80% of the practicing dental hygienists reported that they were confident in educating patients and parents about the HPV vaccine, and 90% were confident in making a strong vaccine recommendation. So these two pieces were very strong. Recommending the vaccine, educating and recommending the vaccine was strong, and people felt confident in doing that behavior. But referring is where things got a little tricky. For the dental hygiene educators, 84% were confident in educating their students on how to refer patients and parents to primary care for the vaccine, and 80% were confident in educating students to make a strong vaccine recommendation. So that's looking at a higher systems level there. Also for advocates, 96% of dental hygiene educators would champion HPV education in their dental hygiene program. And 90% will advocate, 90% of practicing dental hygienists or students will advocate for HPV in their practice or in their future practice. So we're still analyzing these data to look at some of the more specific outcomes and find out what's going on there. But overall, I think it's moving in a positive direction. So now I want to talk a little bit more about the HPV immunization events, how many we've conducted, how they went, and things we've identified for improvement in the next round. So these immunization events, we've coordinated 3 of them, and our goal is to link oral healthcare and HPV vaccine recommendations and have vaccines available on site, so we're eliminating the barriers there. Our focus is for children ages 9 to 17. We've conducted 2 of these events in Denton at the Dental Hygiene Clinic, Texas Women's University, and 1 back-to-school event in Tarrant County. All of these events happened in March, July, and August of this year. So how we recruited for these events is using these flyers. We advertised in advance that the event would focus on free dental cleanings and radiographs for children and adolescents. And all of this care was provided by the TW dental hygiene students. And additionally, we brought other healthcare providers, booths, and resources to the event. Um, and they provided resources about the screenings and other information that was available in the community. At the second dental event, we also had some interprofessional education. So there were hearing and speech screenings that happened too. So we did two events at the Texas Women's University Dental Clinic. One was on a Saturday in March, so right after spring break. I believe it was a week after spring break. And then we modified things and did one on a Friday in July. So we learned a lot of lessons from that on what's better for patients. But also at the community event, the back to school event, you see the community health fair there on the screen. We brought dental supplies and dental hygiene students to the back to school event in August where the vaccines were available. So we were walking around and providing information about the HPV vaccine and framing it within oral cancer. There's also some really unique interprofessional opportunities with the medical students. So I'm at the University of North Texas Health Science Center, and we brought some medical students to partner with a dental hygienist and just learn from them. So it seemed like from hearing from them, they had a really great experience and learned a lot of things that I don't think they're typically exposed to in medical school. So that was pretty neat. So how were these set up? So we advertised in advance how the events were set up, what parents and patients could expect. Parents were required to be present with their children through the dental visit, and the hygienist used the time in the clinic to discuss, educate, and recommend and refer for the HPV vaccine if the child's not current on it. If the patient agreed to the vaccine, we had them complete some consent documents, and we had a vaccine provider provide the vaccine and document everything once the child had completed their dental care. So how we had this set up, we tried something at the first event, and what it was when parents came in after they did their check-in, updated their health history with their child, they were taken to a separate room. So all of the patients were, or the parents were taken to a separate room where one individual student was providing information, like an educational session as a whole, to the parents there. So telling them everything they needed to know about the HPV vaccine and then allowing to make that decision for themselves. And then, because that's not often how things will look in private practice or even in a general day-to-day practice, most places won't have that resource available. For the second event, we provided, the dental hygienist provided education, recommendations, and referral within their operatory right after the health history. The vaccines were offered in a private area away from the dental clinic. And one of the other unique things that happened here is that we had a lot of volunteers that were recruited from the School of Public Health and also our medical school here. And they completed a training, which is called HPV Chat, and its focus is to increase knowledge and confidence in providing HPV vaccine recommendations among healthcare providers. And this is actually another one of MD Anderson's projects. So we had some crossover there. They developed an educational session that we used to train our volunteers. So I thought that was pretty neat. So as you can imagine, there's a lot of background paperwork that goes on with vaccinations, and that including entering and documenting records in MTRAC, which is what the state uses to document all the records. So we partnered with an organization called Passport Health. Passport Health focuses on community-based immunization clinics. And how we got to them is that they partnered with the Denton ISD to provide childhood immunizations for their back to school events. Passport Health is also a Texas Vaccine for Children providers, which covers children who are enrolled in Medicaid or CHIP, uninsured or underinsured. Typically, the vaccines cost $10, but the vaccines were administered at no cost to people who were attending this event. And Passport Health can also file insurance for those who are privately insured. So they were our vaccine provider. We also had a partnership with United Way of Dane County for our first event, strong partnership with Texas Women's University, and then partnered with a kind of a case manager at Little Elm ISD, which is up by Denton, and they helped us recruit participants to enroll in the program. So they really knew the community and knew the families who might benefit most from this. And so they were helping us with translation. Most of them were Spanish speaking. So helping us with translation, helping them get their paperwork filled out and getting them scheduled for the event. So that was a really cool opportunity for recruitment. So what did we learn from these immunization events? So we did collect some data from parents in the clinic, and we are still collecting that data. So we did pre and post tests whenever parents came in with their kiddo. We saw some major increases in knowledge of HPV related cancer. So on the pre-test, 45% of parents identified that oral pharyngeal cancers can be HPV related. And on the post-test, it was 91%. So that's a great outcome. And there was also increases in knowing that HPV could be prevented with the vaccine. So did you know there was an FDA-approved vaccine to aid in preventing cancers related to HPV? On the pretest, it was 64%, and on the post-test, we got up to 91%. Also, some of the metrics that we're measuring is how many children we reached or families we reached overall, because I think just sharing knowledge and awareness of the vaccine or oral healthcare in general is really important. So at our two events where we were providing oral health care, 59 children received oral health care. Most of those were undocumented or children experiencing homelessness. So that came through the partnership with Little Elm. We had the March event was much bigger. Our first event, we had 43 children there and then 16 patients at the July event. At the community event, we weren't providing oral health care, but we did provide education and resources at the community event to about 1,300 people. It was a fast moving event, so it was difficult to track, but we're basing this on how many backpacks or resource kits were given out at the event. And overall, throughout the project, we've administered 156 total vaccines. So we still have a lot of data from this that we're collecting and still analyzing these data, particularly among parents in the clinic. I think it's a really unique opportunity to learn more about how parents feel going through the experience and determining if they end up ultimately consenting to the vaccine for their kiddo. So about the project. We've had a lot of wins. It was a really fun project. We had some incredible support and some buy-in from dental hygienists and dental hygiene programs. I am thrilled with the partnerships that we made, and I really see this as being sustainable, both through the training, but also through the event. We formed some strong community partnerships that we didn't have before. Before doing this work, I had no relationships with anyone in Denton County. So that's been really helpful learning about the community and learning who the key decision makers are. And then one of the biggest wins is that we increased access to oral health care, but also we increased access to the HPV vaccine and provided some education and vaccines to parents and kiddos. We did have some challenges too, which I think we can address in future rounds and moving forward. So one of the issues that we had was recruiting patients for the dental hygiene clinic events. We first had the event on a Saturday, and we thought that was, it ended up being good, but we thought we might try it on a Friday over the summer. That ended up not being the best fit for parents and being able to attend. It also seemed like there was some difficulty getting to these clinic events. So we have some plans to address that in the future. One of our biggest challenge was documentation related to vaccine records. As a non-clinician and someone who's involved in this project, I didn't have access to looking at vaccine records or documenting anything related to vaccines. So we had to bring in an external provider to do that, and also some medical students and some nurses to review vaccine records and determine what vaccines the kiddos needed or were eligible for. We did improve dental hygienist skills, and I think we'll know some more specifics as we move this project forward and continue to analyze the data. But I think that we have realized that instead of focusing on increasing knowledge about the HPV vaccine, we need to focus on some more concrete skills and maybe some application of educating, recommending, and referring for the vaccine. So that could be through case studies, that could be through role plays. Um, there are a lot of different ways that we can look at that for the future. And we did what's called an HPV refresh session. So we went back to the students that we had already worked with and walked them through some videos, some sessions of what this actually looks like in practice to give them some examples. And also, like I said before, we're focusing on the timing of clinic events. March, I think, was a good time. Summer wasn't the best time. So we've learned a lot about when to time it in the year. So where are we headed next? We are looking at expanding this project. One of the things that we've thought about doing and are still considering is providing oral cancer screenings at local health fairs. We also, for kiddos, have focused on providing fluoride treatments or toothbrushing instructions, maybe just other dental resources at these fairs that are already going on. So instead of asking people to come to us at the dental clinic, we'll go to local health fairs where people already are, and we'll bring HPV vaccines with us. So one of the ways we're kind of working on thinking through that is using an intergenerational approach to providing these HPV vaccine recommendations. So we're providing them to parents, but also we might be providing some education or oral health treatment to patients. One of the things we've also explored is the opportunity of mobile dental hygiene. I think that becomes a little bit more complicated when you're talking about a local health fair because those are usually a quick turnaround. But I think fluoride treatments, toothbrushing instructions, things like that are much easier to provide. And we've also talked about another direction is standardizing how to incorporate these HPV vaccine discussions into dental hygiene program curriculum. So what would this look like if there was some type of evaluation associated with this in a dental hygiene program? And how would we move forward with getting that standardized into dental hygiene programs and replicated? We've also talked about ways to modify the advocacy training, and those focus specifically on more skills and application and other case studies. We also are one unique thing that I didn't really talk about is that we incorporated HPV vaccine questions and HPV vaccine questions and other health history questions onto the EHR and in the health history form. So we have some information before the students did the training on if they were asking patients about the HPV vaccine or discussing it with them. But then also we have some chart records from after, so we can do a comparison there and determine how that went and if there's a better way to do it. What's cool is that they're also doing this at a dental school. So we'll have some comparison there now that we can make across programs. And what else is next is that our previous work has focused on children, but recently the HPV vaccine recommendations have changed. Now they include adults up to age 44, and the recommendation is that the people in this age group meet with their healthcare provider to make a shared clinical decision about if they should receive the vaccine or not. So I think in the future, as we move forward with that, there's some opportunities there, which will look differently. Instead of talking to a parent about a kiddo, you only have to talk to one individual about their own healthcare. So I think that could look really different as well. So I have a couple minutes left, and I just want to walk quickly through some practical steps of how this could be applied in practice or incorporated into what you're currently doing in your clinics. So this is from the HPV vaccine roundtable, and I'll make sure that we share the link. This is a cancer prevention through HPV vaccine. It's an action guide for dental healthcare providers. So there are a few steps there. I want to walk through each of them, but overall, it's focused on educating patients and parents of vaccine age eligible children. So the first step that they recommend taking, they call them actions. The first action is knowing your unique role. So although dental providers aren't really in a position to screen for oral HPV, it's further back, difficult to see. We can work on reducing the incidence rates by promoting HPV vaccine. One of the ways to do this is familiarize yourself with the ADA and AAPD statements and what their recommendations are. Also, there's some opportunities to quickly build on your existing practice. So if you're already doing nutritional counseling or counseling on tobacco cessation, that might be an easy way to incorporate HPV vaccine discussions into your practice. Action 2 is practice cancer prevention. So reinforce that the HPV vaccine is cancer prevention. One way to do this is include a question about immunizations on the medical history form. Begin the discussion about the HPV vaccine while reviewing your patient's comprehensive health history or when you are completing oral cancer screening, so you can tie it in there. But overall, this aim is about talking to patients about the vaccine and cancer prevention. Action 3 is referring patients for vaccinations. So the recommendation is that providers refer their patients to primary care provider, stress the importance of vaccination at ages 11 to 12, although we're starting at 9, so I'd say 9 to 12, and then follow up with the patients on their next visit to kind of close the circle. If patients are lacking a primary care provider, you might share your recommendation and then encourage them to contact the local health department or a federally qualified health center in your neighborhood. There are also some really cool referral resources. So Team Maureen has a printed HPV vaccine prescription pad, and it's just a referral form that's made available, and you can print it out and hand it to the patient before they leave. Action 4 is collaboration. So consider forming relationships with pediatricians and primary care providers for a continuum of care. And we're also recommending consistent messaging across providers. So if they hear that HPV vaccine is cancer prevention from a dentist and a primary care provider, it might make a difference. And also, primary care providers have a responsibility to talk about HPV vaccine and its relationship with oral cancer as well. The fifth step is engaging your team. So educating the entire team about the link between HPV and oropharyngeal cancer and ensuring that they all know the difference between oral cancers, which has risk factors like alcohol and tobacco use, and oropharyngeal cancer, which is primarily associated with HPV. So you can also create a cancer prevention culture in your office by arming staff with the right language to talk professionally and confidently about the vaccine. And then you can establish processes that make appropriate recommendations for your patients. And in this action guide, there are a lot of links that there are a lot of resources that are available in the links that show you some examples of how this can be done. And the final step is creating a pro-immunization vaccine environment. This is by displaying posters, brochures, flyers, or handout, and using pro-immunization messaging on your online channels or patient portals, maybe even your practice website or other social media outlets. And again, this action guide has links to some really, really great resources that can help you and let you see what it actually looks like in practice. So just to wrap up, I've been talking for a while. Just to wrap up, the Healthy Smiles Initiative is two parts. It focuses on advocacy trainings for dental hygienists, but also incorporating community-based immunization events into practice. I will say that HPV vaccine is cancer prevention. So that's one of the best framings that I have heard. I love to use that language. And overall, oral health providers have a role in educating, recommending, and referring their patients for the HPV vaccine. That is all. I think I've summarized the project quite a bit and given you some context to think about for vaccine rates. But I would love to hear if there are any questions or anything else that you might like to talk about.
Absolutely. Thank you, Dr. Griner. And you can unmute yourselves if you all would like to ask a question verbally with Dr. Griner, or you can put something in the chat box. I did post something early on in the chat box.
Oh, you did?
Well, it was about when you were talking about the events.
Mhm.
I was interested in knowing who is administering those vaccinations at those say healthcare events or something.
Yeah. So this took a lot of work. This is one of the hardest things that we had to figure out for this event. We went through a lot of routes. We tried to partner with the public health department, but they have difficulty doing mobile events. And so taking their resources out of their healthcare department.
Okay.
And we really wanted to reduce that barrier. I think we have an opportunity there to bring vaccines to people to eliminate the barrier of going to another healthcare provider. So it was like key important to the event. We ended up going with an organization called Passport Health. They specialize in doing mobile clinics and they're really, really great at what they do. So it was a wonderful experience, and I'm happy to share their contact information if that's something anyone wants to explore in the future.
Yeah, that would be great.
Yeah, they're really good.
And very, very good. Early on, you mentioned that some states, the dentist can administer vaccinations, HPV.
Mhm.
What about Texas?
No, Texas not yet. I would like to see it. I've been following closely about the policies that we had under review this year, and
Right.
there were a few that I would have liked to seen pass that we didn't quite make it for. So I think we have a lot of opportunity for advocacy. Um, and if we can kind of get together and focus on our core topic areas, we might be able to make a difference. I think in the South, generally, this will take a while, but we'll get there. We'll get there. There's a lot of logistical issues to think through, right? How are we going to document this? What does it look like when we're putting it into practice? How will, if you get a vaccine at a dentist, how will a healthcare provider know that you've gotten it and you're
Exactly.
upstate? So thinking through some of the logistics as well. And I think through Oregon is one of the big states that's really been successful at this. Learning from what they do would be really easy to replicate.
Yeah, I think the electronic health records would be, we would need to be able to tap into both medical and dental.
Yes.
Let's
Yeah.
see some of the questions here that we might have. Um, Regarding dental care providers not being knowledgeable, what is the best resource to educate on HPV? Good question.
Oh, yeah. So one that's easily available is the self-directed learning that we have on the Texas Oral Health Coalition website. That is actually Janie's CE that we've been using in practice. So readily available to you. But I would say I really like the resources from the HPV Roundtable. They have some specifics that are focused on oral health providers. They have a really great handout sheet that we've used in practice just for some dental hygiene students who are uncomfortable. And they said, what if a parent has concerns about vaccine safety? So they have
Hmm.
some specific language that you might want to use. And that's just one sheet. You keep it readily available and give it a try. So I really like that resource. And I'll try to find the link. And I'm pretty sure it's on, I'm pretty sure Janie talked about it, but I'll double check that.
Okay, and I'll make sure that we add those to your webpage,
Oh, yeah. Thank you.
so that they can access some of these resources. Love the seeing the CDC posters that you showed. One of my
Yeah.
questions is, where can we find a poster that people can put up in the operatory or the waiting room?
Yes, absolutely.
So,
That is that link. So I will make sure we get it to you. They've done some really, really great work. At the beginning, when this conversation first started, the resources were very just getting started. So now we've
right.
had some time to perfect them and everything's looking really good.
Is there like a 1 or 2 page handout that the dental hygienist could hand to the parent or the patient that would have information about the HPV vaccination? Is there something else other than just seeing a poster
Yes,
that they could take home and read? Yeah,
yes, we have some great resources. Actually, that's been one of the projects through MD Anderson has been focused on developing those materials. So I have some of those I can share as well. And it just
okay,
hits the key points on when is the vaccine recommended, why is this important for my kiddo, the safety and efficacy of the vaccine, things like that.
right. And speaking about the vaccine, I wanted to ask about, because I know when I've talked to other dentists before years ago about doing vaccinations and things in the office, what their concerns were: one, does it have to be refrigerated? Because they're thinking, this is something else that I have to do, and I don't have the
Hmm.
room for it. The expiration date on these vaccinations, sometimes they're pretty quick. And so if you have to buy a lot and you don't have a high number of children coming through your office, then they're going to expire and you basically wasted a lot of money. So the community health centers, the FQHCs, that's really where they can
Yes,
receive those vaccinations, or from their primary care office. Is that correct?
yes.
Okay.
Absolutely. I think federally qualified health centers are so cool because there aren't that many places where you have medical and dental co-located.
True.
So it's a great way to test out and see how these concepts work in real life when you're able to eliminate that barrier.
Okay. and I loved hearing about the health fairs.
Yeah, so we had the best turnout at the back to school event. But
Oh, August.
yes, so and
Okay.
I think always for vaccines you will.
Yeah.
That's the time, but I think it's the difficult part is bringing oral health into that
Okay.
because I think we have some opportunities, right? That event
Yeah.
happened quickly and we were responsive. The community needed a vaccine provider. I said absolutely. But if we have some time to plan it, I think I've learned some valuable lessons. We could replicate it and improve it.
Let's see. What else? Do we have any other questions? Lynn Sutherland, did you have any questions for her?
I was just thinking as far as scheduling a time that April, Oral Cancer Month,
Oh,
would
that's
be a
fun.
good time
Yeah.
Oh,
Yeah, that'd be really good.
that
to
would
kind of incorporate those into the oral cancer screenings that
Yeah.
different places are doing.
Did anyone have any questions? Yeah, I was really disappointed seeing Texas was 48th. That was
I
very
know.
depressing. That's like, okay, we've
I
got to do
know.
something, and we've got to do it quickly. I was interested hearing that the recommendations have gone all the way up to age 44 now.
Yes.
So that's really good.
Yep.
I do, yeah, that's tremendous. Well, does anyone else have any questions for Dr. Griner or any closing comments? I think you've given us a lot to thinking about. Thank you again so much for your time for presenting this and for sharing information about your project. So thank you again, Stacey, for joining us and presenting. We really appreciate your time and this wonderful presentation and information that you shared. So
Thank you,
thank you
Beth.
all and have a wonderful rest of the afternoon and weekend.
Bye.
Okay, bye-bye.